The Far West, up until 8 p.m. last night, had 0 cases. We also had 5 more cases recover overnight, which means we only have 19 active cases in the region, and they're all in Dayton, Wentworth area. And again, of course, we have no patients in hospital as we speak. We have sought the assistance of ADF, medical teams, to come back and provide vaccination clinics in the Dayton, Barreynolds, Wentworth corridor. They will be on the ground as of next week, and I'll give you details of that in a little while. But I wanted to give you some information on our current vaccination rates. So this is for people over the age of 16. There has been certainly quite an increase. As a region, we are at 93.7% first dose and just under 81% second dose. But just give you some individual postcodes. Broken Hill and unincorporated is at 95%, just over 95% first dose, and just over 85% second dose. Menindee, 100% first dose, and just under 94% second dose. Barreynolds, 93.5% first dose, just over 81% second dose. Wentworth, just under 90%, and you'll recall they were quite low and they really come up, and 76% second dose. Euston is 95% first dose, 58% second dose. Golgol is 87% first dose, 70% second dose. Wilcannia Whitecliffs is 71% first dose and just over 62% second dose. Again, of course, Wilcannia numbers have those people who are not vaccinated when they contract the virus. There is also development on that front. The previous ATAGI and the Chief Health Officer's advice was that if you contract the virus and you were not vaccinated, you had to wait 2 months, and that was a special exemption for Wilcannia. Now that exemption, in fact, has now become even better. You can get your vaccination straight after you're cleared. So if you're cleared today, you can basically go to any of our clinics and get your vaccination, and we'd really encourage everyone to come forward. Ivanhoe is 88% first dose and 76% second dose. So one of the reasons why we are focusing on certainly Euston, Dayton area is that the second dose there is low, comparatively speaking, but they do have very high first dose, which means we've got a large cohort of people who are eligible for second dose. Now, certainly we can provide the second dose over a longer period of time within our constraints of our resources, but with extra resources we can basically shorten that time frame. We want to really get them up to 80% by the end of next week, if not by next week, certainly early the following week. So look, that certainly is, I think from our point of view, is good news. Also wanted to highlight the fact that our vaccination venue in Broken Hill, of course, has changed as of today. It is now operating out of the Musicians Club on Crystal Street. Last point that I wanted to make was that ATAGI has provided clear advice on the provision of booster doses for people who are immunosuppressed or immunocompromised. We are currently working on a plan to really either contact or provide the information for people to get in touch with us to get their third dose, either through us or through their local GP. Last but not least, we are still getting positive sewage detection. On samples that were taken on the 19th and we received a result on the 20th, Wilcannia Broken Hill, and Broken Hill South have all returned positive ratings. As you recall, Broken Hill South had returned negative results the time before. Unfortunately, that's become positive as well. We still have no detection in Balreynolds. Detection certainly at Dareton and Barunga. Wentworth proper has not returned a positive result yet.